All right, in Fox 5 Health News, the CDC says flu season is peaking all across the country, with states in the Northeast, including New York, getting hit very hard. And to their surprise, health officials say swine flu is making a comeback.
And joining us right now, Dr. Keri Peterson from Lenox Hill Hospital. Thanks for being here, Dr. Keri. You always look great, happy and cheerful. But
thank you, Ernie.
unfortunately, we got to talk a little bit about the flu problem. What kind of a season is it going to be?
Well, it's certainly in full swing, and based on numbers the CDC has released, there are going to be a number of cases in New York. There are 10 states that now have widespread outbreaks of the flu, up from 4 just last week. So it is increasing very rapidly, predominantly in the South and in the Northeast. That includes New York, Massachusetts, and Pennsylvania. I diagnosed a patient last week for the first time, so it is here.
Wow. And something also alarming, swine flu is back?
Swine flu, 97% of cases are found to be the H1N1 virus that we first heard about in 2009. So it is here. 97% means the majority. What's unique about the H1N1 that's a little more concerning is it has additional symptoms other than influenza, typical A or B. It not only has the fever, aches, cough, and congestion, but it can also have stomach upset like nausea, vomiting, and diarrhea. So you're more predisposed to dehydration, especially those kids and the elderly that have the H1N1. But the good news, it is in the vaccine.
Okay.
The H1N1 is in the flu vaccine for this season. And also, if you did not get the flu shot and you are diagnosed early, it has been found to be sensitive to the over-the-counter, to the prescription drugs available.
I was going to ask you that. What else can we do to protect ourselves? Because the season's going to be around for a few more months, right?
At least a few more months, certainly through early spring. And in terms of prevention, the #1 thing that you can do is to get the flu shot.
You can still get it now.
It is never too late to get the flu shot.
Still effective,
It is still effective. It takes 2 weeks to kick in, so get to your doctor quickly if you haven't gotten it so far. And another tip, wash your hands.
Yeah, that's very important.
It's very, very important.
But,
you keep hearing that over and over again, but it works.
You can't say it enough.
Makes a difference.
Don't touch your face either.
Exactly. Okay, I'm going to wash my hands right now. Do you mind if I do? I wish we had a little soap here.
Go ahead. We'll just move along here. Also in today's health headlines, besides the flu, Ernie, there are some common ailments that can take you out of commission. Yeah,
a new study finds that some germs that cause infections like strep throat can live a lot longer on surfaces than previously thought, so that's a problem here.
It is. Now, strep throat is caused by streptococcal bacteria, which also causes ear infections, sinus infections, and even pneumonia. And it was thought that once it was touched a surface that it died in a matter of a few hours, so that if you sneezed onto your desk and you touch your desk, you really can't transmit it after a few hours. However, a new study has found that it can last for over a month on a surface. And it looked at daycare centers. It found that the strep lived on toys for greater than 4 weeks.
Really?
So that means that children can carry it and take it home.
That's alarming to think
about.
That really is. What illnesses can strep cause?
It can cause any type of respiratory infection, like the ears, the sinuses, the throat, and even in the nose. And the concern is, we originally thought that Streptococcus lived just free as little cells, like almost think of little peanuts or M&Ms scattered around. But now what we know is they come as these biofilms, which are these clusters that are all bound together in these little communities of strep, and that's what is surviving longer than just the little M&Ms tossed around. It's like a pecan cluster instead of a nut on the desk, and that is surviving for months. And so that is what can infect us for much longer periods of time.
So now that you've described all of this and making us crazy, what are we supposed to do to try to protect ourselves, right? Because that's not something that you want to get down with.
Correct. Well, for streptococcus, wash your hands, as we mentioned. Don't touch your face. That includes rubbing your eyes and biting your nails. I like to tell my patients, pretend there's a glass table at your neck that your hands can't get above. Also, disinfect your surfaces regularly. All those high traffic areas like your mouse, your keyboard, your telephone. Every Monday I take a Clorox wipe and I wipe down everything that I touch regularly so that I know I can start with a fresh start for the week. And carry hand sanitizer. You mentioned you wanted to wash your hands, Ernie. There's no sink here, but if you had a little hand sanitizer
we
on
do.
your
We
desk,
have one over in the weather desk. Audrey's been using it all afternoon. We have to get it back from her. But, you know, it really is interesting because, you know, you talk about protecting yourself and you say, you know, do I have to really think about all of this when you're shaking hands with someone? It's a season when you kiss people, you bear hug, it's holiday time.
You must think about it.
Well, what do? Do you just say, sorry, I've got a cold, or don't get close to me?
Well, you can do the fist bump.
The fist bump,
That's a good one. And you can cough into your elbows or your mouth. I still see patients not covering their mouths when they cough or sneeze. You've got to cover your mouth. You have to be conscientious.
Yes, you do.
And if not for yourself, then for your family and your loved ones at home.
Yep.
I do an air kiss. I'm like, go, there we go.
That's because you're wearing makeup. You don't want to get clothes.
I have the glass thing right here, Audrey.
Dr. Keri Peterson, we love having you on our program.
Thank you.
Thank you so much for being here, and a Happy New Year to you and your husband and your family.
To you too, Ernie and Sharon. Thank you
yes,
very much.
Happy New Year.
Absolutely.